Muscular or spasmodic stricture. Spasmodic stricture is an involuntary contraction of the compressor urethrae muscle of sufficient force to impede or to prevent, temporarily or permanently, the passage of urine from the bladder. I have encountered no case of spasm of the pendulous urethra, though de Bovis records 2 cases. Spasmodic stricture is a symptom, not a disease. It always depends upon some separate and distinct condition. It varies with the variations of this etiological factor and disappears with its cure. A common predisposing cause is a sensitive, high-strung nervous organization, particularly in one who is sexually excessive. Such a one is unable to urinate in the presence of his fellows, and the more anxious he is to pass his water, and the more water there is to pass, the more difficult does he find it to satisfy his desire. Certain mental suggestions contribute to increase or to diminish the spasm. The sound of running water often breaks the spell, while derision or absolute silence has the opposite effect. I have known a commercial traveler who, during 20 years of life spent mostly on the road, could not urinate in a railroad except by means of a catheter. Yet such a man may well go through life with no great inconvenience from his urethral idiosyncrasy, his urethrismus, as Otis termed it. But let him acquire an organic stricture or a vesical calculus, let him be operated upon for hemorrhoids, or suffer any local or constitutional strain or shock, and his urination immediately becomes difficult or impossible to accomplish for a greater or less space of time. I have known an operation for hemorrhoids to occasion complete retention lasting 10 days, long after the patient was up and about. Such a spasm, if unrelieved by catheterization, may even cause rupture of the bladder. Thus there is this much in the theory of Otis that an abnormally small meatus may cause urethrismus, that if the meatus is small enough to irritate the urethra by impeding urination, it may excite a spasmodic stricture, though I have never known it to do so. Symptoms and diagnosis. The cardinal symptom of spasmodic stricture is inability to urinate. Hence, it is sometimes confounded with organic stricture. Indeed, not a few patients with stricture deemed impassable, when put upon the operating table, have been found to admit a full-sized sound, being cases of spasm with little or no organic stricture. The following differentiating points are therefore memorable. 1. Spasmodic stricture occurs only in the membranous urethra. 2. Unless there is some organic lesion of the urinary tract, the urine is bright and sparkling and free from shreds, which it very rarely is if there is organic stricture sufficiently marked to seriously arrest urination. 3. Although it may be impossible to introduce a filiform bougie or a small sound, a full-sized sound, if allowed to rest for a few moments against the face of the stricture, will usually tire the muscle and finally slip into the bladder. If it slips in by its own weight, its course will often be jerky and irregular, as the muscle gives way by succeeding spasms of lessening intensity. 4. When the instrument is once introduced, the obstacle is wiped out, and the withdrawal of the instrument is not opposed by any such grasping as is felt when there is tight organic stricture. Footnote: but if the instrument passed as a small one, less than 20 French, it does not overstretch the muscle and may therefore be grasped on withdrawal. 5. Even though a spasmodic stricture be absolutely impassable, general anesthesia will entirely relax it. 6. Organic and spasmodic stricture often coexist. Footnote: indeed, continued spasm may doubtless cause ulceration, just as spasm of the bowel causes fissure in ano. Indeed, organic stricture is the most common cause of spasm, and spasm may be the notable symptom of an organic stricture of large caliber. Treatment. The retention may be relieved by a hot sitz bath or by catheterization. The tendency to spasm is overcome by removing the cause and improving the general hygiene, special attention being paid to sexual irregularities, concentrated urine, and organic stricture. To prevent recurrence of the spasm, I know nothing better than the passage of a full-size steel sound to overstretch the muscle and silver nitrate installations to blunt the sensibility of the deep urethra.